Hello, everyone. I'm Eliana Perrin, a general pediatrician and clinician researcher. I'm the Bloomberg Distinguished Professor of Primary Care in the Department of Pediatrics and the Schools of Medicine and Nursing. I'm here to tell you about my researcher's dream come true, our study publication in JAMA, which reported on a randomized clinical trial of obesity prevention. So why is this a dream come true? Well, because my whole research career has been spent thinking about ways for primary care providers who see children for well child care to prevent and treat obesity and its lifelong cardiovascular sequelae by helping parents help their children grow up healthier. And this study did exactly that. In this publication, we reported on the Greenlight Plus intervention, which aimed to prevent obesity at age 2 by starting with newborns and their parents. This was a comparative effectiveness trial funded by PCORI that looked at the effectiveness of adding text messaging that was health literacy informed, tailored, and responsive, as well as a web-based dashboard to support health behavior goals around feeding, physical activity, sleep, and screen time. We called this digital intervention the Greenlight Plus intervention, and we studied the effect of adding it to what was basically an enhanced usual care situation of clinic-based health behavior counseling. We called this second group the clinic-only group. In the Greenlight Plus digital intervention group, parents got an initial goal by text, like helping their infants not engage in screen time, and then 5 check-in messages about that goal over a 2-week period. We then repeated goals every 2 weeks over the 2 years. The texts were automated but felt personal because we used the parents' and the children's first names, and they were in English or Spanish according to parent choice. Based on their responses, we gave parents cheerleading and encouragement as well as tips to reach their goals. They also got a customized web-based dashboard that reminded them of their goals and their progress and tracked their child's growth on a color-coded growth curve. Overall, 900 infants and their parents were enrolled in the trial from 6 academic sites nationally. Half were randomized to the Greenlight Plus digital intervention, and half got the clinic-only intervention. What we found is that the Greenlight Plus digital intervention group had a lower weight for length or a healthier growth curve over their first 2 years of life. And importantly, there was a 44% reduction in childhood obesity at age 2 years. This was a racially and ethnically diverse population, and the intervention actually worked best in groups thought to be at highest risk for obesity. So why is this study important? This study was important because it was one of only a couple of studies ever to succeed in the primary prevention of obesity, and our study was certainly the largest and the most diverse. Second, we now have another tool in our toolbox to help primary care providers, and this one doesn't add additional stress to the provider because it takes place asynchronously to patient care. We never expected parents would stick with us for 2 years with the texting, but they did, so we have another option for health counseling that we may not have expected. Third, this intervention is already built and easily scalable, and we know that scaling it and having its effect on obesity reduction and closing those health disparity gaps can have a major impact on the nation's public health, so we're ready to work on implementation. As a takeaway, let me say that this was a very successful intervention that helps those at greatest need and is ready for implementation science to help it be available at scale so the nation's children can grow up healthier. I'd like to thank PCORI, who funded us, my many collaborators on the study, the research coordinators who worked so hard to recruit 900 children and retain them for 2 years, the families who were enrolled in our intervention, the parents and other partners who helped us with the intervention, all of you. We couldn't have done it without you. Thank you so very much.